Hello everyone, welcome to PharmaGrid. So in this video, we are going to continue with the quick revision series. So let's begin. First point, drug is at steady state when rate of infusion is equal to rate of elimination. Or we can say that steady state concentration is a dynamic equilibrium reached during a prolonged or repeated administration of a drug where the rate of administration or input equals the rate of elimination from the system. Next point is initial concentration is determined by dose and apparent volume of distribution. How long to get to a steady state or time to reach the steady state is approximately 4 to 5 half-lives. Next point is about a drug interaction between omeprazole and clopidogrel. Omeprazole is a proton pump inhibitor whereas clopidogrel is an antiplatelet agent. Clopidogrel is also a prodrug that requires activation by hepatic cytochrome enzyme, that is CYP2C19, whereas omeprazole is a strong inhibitor of CYP2C19. So when these drugs are combined together, what will happen? This omeprazole decreases the clopidogrel effect by blocking the formation of active metabolite because omeprazole is a strong inhibitor of CYP2C19. Next point is tendency of drug to bind with receptor is known as affinity. Methenamine hippurate, also known as hexamine hippurate, is converted to formaldehyde and ammonia in an acidic environment. Methenamine is an urinary tract antiseptic agent. The formaldehyde formed, it will denature the proteins and nucleic acids which is responsible for causing bacterial cell death. Methenamine combined with a weak acid, for example hippuric acid, in order to maintain urine acidity and promote the production of formaldehyde. This methenamine is or it's contraindicated or should be avoided in hepatic insufficiency because of ammonia formation. Phase 2 metabolism reactions are also known as conjugation reactions. Here, coupling between drug and an endogenous hydrophilic substrate such as glucuronic acid, sulfuric acid, etc. to create more polar conjugates. Thus, conjugation enhances drug hydrophilicity or water solubility. All conjugated products are pharmacologically inactive except morphine glucuronide, which is more active than morphine. Phase 2 metabolism reactions includes glucuronidation, glycine conjugation, glutathione conjugation, sulfation, methylation and acetylation. Levodopa, which is a medication used for the management of Parkinsonism, is a dopamine precursor. Its metabolite may cause dark wine urine color. Next point is ergocalciferol, that is vitamin D2, is a derivative of ergosterol. This vitamin D2 or ergocalciferol, it's converted in the body to calcitriol or vitamin D3, which is the active form. Clopidogrel is a prodrug. It is a thienopyridine derivative used as an antiplatelet agent. Next important point is weak acids get absorbed in the stomach whereas weak base in the intestines. So here remember the golden rule. Absorption requires same medium whereas excretion requires opposite medium. That is, for absorption, acidic drugs get absorbed in the acidic medium whereas basic drugs in the basic medium. That is, acidic drugs absorption from the stomach where there is acidic medium. For example, aspirin. Basic drugs get absorbed from the intestine where there is a basic medium. For example, atropine. Potassium chloride is formulated as sustained release formulations to allow for delayed absorption and peak effects. This is to avoid gastric irritation and prevent both hypokalemia and hyperkalemia. In regular immediate release oral tablets, the bioavailability is primarily determined by dissolution. Enteric coated or controlled release tablets, that is in case of enteric coated or controlled release tablets, disintegration is the rate limiting step. Urine acidifiers, for example ammonium chloride, increase alkaline drug excretion by ion trapping. For example amphetamine. Amphetamine is a basic drug. So here remember, for excretion opposite medium is required. That is, for the excretion of an acidic drug basic medium is required, and for the excretion of a basic drug acidic medium is required. Then what do you mean by T-half? It is a time required for the concentration of a drug to decrease by 1/2 or time of drug to reach 50% of its concentration in the blood.